Hello, my name is Caitlin Canning. Here is my reference card. Today I will be talking about a subarachnoid hemorrhage, which is defined as bleeding in the surrounding area of the brain. It is classified as a hemorrhagic stroke. So you have two kinds of strokes, ischemic or hemorrhagic, and this is a hemorrhagic stroke. The etiology of a subarachnoid hemorrhage would be a rupture in the cerebral vasculature of the brain. So that could be anything from a ruptured aneurysm to an arteriovenous malformation leaking, or even sometimes moya-moya syndrome, which is kind of an entanglement of vessels in the brain. The pathogenesis of a subarachnoid hemorrhage, so I talked about the etiology, how it's a rupture in the cerebral vasculature. The pathogenesis is the vasculature, most of it, so the circle of Willis sits in the subarachnoid space. Once that rupture happens, the blood disrupts the flow typically of cerebrospinal fluid, because that happens in the subarachnoid space. So that can cause pushing on the brain because there's only so much room in your skull. It can also cause a lot of discomfort because it is disrupting the flow of the CSF, so it can go down into your spinal column and other areas around your brain. The symptoms of a subarachnoid hemorrhage are typically worst headache of life. So the patients come in and say that they have the worst headache of their life, or a thunderclap headache. They can feel nauseous, they're sensitive to light, and they maybe have double vision, or feel weakness on one side of their body. The signs of a subarachnoid hemorrhage could be loss of consciousness, seizures, facial droop, vomiting, anything like that. The syndrome of a subarachnoid hemorrhage is the classic subarachnoid symptom. So it could be considered a subarachnoid syndrome, where you have the worst headache of life, nausea, vomiting, photophobia, neck pain, etc. The diagnosis of a subarachnoid hemorrhage, as I said, is subarachnoid hemorrhage due to an aneurysm rupture somewhere on the circle of Willis typically. The complications of a subarachnoid hemorrhage could be diabetes insipidus, system of inappropriate antidiuretic hormone, vasospasm, which is where the vessels in your blood open and clamp down and become irritated, and that can present as a waxing and waning in a patient's mentation. Patient can become lethargic or have changes in their neurologic exam, or hydrocephalus, which is fluid in the brain, which can cause swelling. Prognosis of a subarachnoid hemorrhage varies patient to patient. Some patients are very, very sick when they come in with subarachnoid hemorrhages, requiring intubation and other breathing support. They require 14 days in the ICU, if that. And then there are other patients that come in that are walking and talking and don't have a lot of confusion. They are able to talk about their symptoms. They are able to orient. And then there are two grading scales that are used with a subarachnoid hemorrhage that help with prognosis. There's the Hunt and Hess score, which is based on patient symptoms. So the less symptoms, the lower the grade. And then opposite, the worst symptoms, the higher the grade. And then there's the modified Fisher scale, which looks at the picture of, or the image of the brain, and based on the amount of blood, that kind of dictates how severe the bleed is. Diagnostic tests for a subarachnoid hemorrhage would be a CT, a CTA, which is a CT arteriogram, where they shoot contrast into a vessel and it allows you to see the vessels of the brain. A lumbar puncture, so they do a spinal tap, and if there is blood in the fifth or fourth container of CSF, that is typically when they would say, yes, this is a subarachnoid hemorrhage. An angiogram, where they go in through your groin or your wrist and they take a real look at the vessels in your brain, or not really the gold standard, just because it takes up a lot longer than the other tests, would be an MRI. So that's a quick little rundown of subarachnoid hemorrhage and the details and classification, etiology, pathogenesis. I hope you enjoyed. This is one of my favorite topics to talk about. Thanks.